Okay, it's about 4 minutes after. I think we're going to go ahead and start. Small group today, but this is recorded, so hopefully people will go back and check out this great information. I want to thank you for being here. My name is Lori Keel. I'm the manager of field development for Autism Speaks in this region. I'm based in Washington, but I do visit Idaho frequently when we're not experiencing a pandemic. Hopefully we'll get back to normal sometime soon, and I would love to connect with you. My contact information will be included in a follow-up email. So thanks again for being here. Before we get started with today's topic, I want to take a moment to acknowledge the important and difficult conversation going on nationally about systemic racism and inequality, fueled by nationwide protests over the death of George Floyd and others. Autism Speaks has issued the following statement. Autism Speaks is dedicated to that's my statement. Sorry. The statement is, deeply ingrained in the Autism Speaks mission is a commitment to creating a more equitable world for those we serve. The autism community is diverse and broad, including all races, ethnicities, abilities, socioeconomic groups, belief systems, and identities. We stand with our volunteers, our colleagues, our partners, and every member of our community in speaking out against racism and speaking up for a world that is more inclusive and empathetic, where all people are respected, protected, and valued. And now I'd love to tell you just quickly about our mission, which is to promote solutions across the spectrum and throughout the lifespan for the needs of people with autism and their families. We do this through advocacy and support by focusing on 5 key mission objectives. Those are increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs in the areas of causes and better interventions for autism and related conditions, increasing early childhood screening and timely interventions, improving the transition to adulthood, and ensuring access to reliable information and services throughout the lifespan. It's now my pleasure to introduce you to Judith Ursetti, Autism Speaks Director of State Government Affairs.
Judith, you're muted.
Thank you. I keep doing that. Thank you so much. And thank you so much for joining us today. It's a really challenging time for the autism community, and we at Autism Speaks are working hard across the country just to make sure that we're staying in touch with you and responding with meaningful advocacy on the federal and state level. So we wanted to just respond to that today. We've heard from many of you via webinars, via our autism response team, on social media about different things that you're experiencing during this time of pandemic. Educational services are being disrupted, day programming is disrupted for those who might utilize that. Access to clinics has been disrupted. And then of course, moving to telehealth for some of you has been really great, and for some it's been very challenging. Needed mental health supports for autistic individuals and for their families, that might be harder to access. And then of course there's that lack of connection to community opportunities and supports. There's been a severe disruption of employment opportunities through your VOC rehab and through other agencies. The discontinuation of respite for some of those of you who might be able to access respite. The routines that we all count on to get through the day in the autism community. It's critically important, and that is a challenge right now for many. Loss of income is devastating. People who are autistic and their families have many economic challenges that they face. We know that challenging behaviors are something that our community deals with. Self-injurious behaviors can spike during times like this, as can aggressions for people on the spectrum. And that is very hard for the person on the spectrum and their loved ones and their caregivers. And then of course, just access to healthcare with appropriate supports. Can people with autism actually have loved ones with them if they're accessing healthcare, if they're hospitalized, or are they able to have visitors. These are the things, the recurring themes that we're hearing from you in our community. And so we want to let you know we're here and we want to talk with you about what's happening federally and on the state level with regard to those challenges. We also want you to know about our autism response team. They are wonderful and they're available around the clock. There's an 800 number you can call. They have a number that's Spanish speaking, the person who answers the phone. And then of course we have an email address, help@autismspeaks.org. And if you go to autismspeaks.org, our website, there's someone there who's manning the chat box and can answer questions that way too. So we want to in every way be here for you, especially during this challenging time. We're going to talk today about many things. Federal advocacy. Dave from our federal team is going to give you an update about what's happened in Washington, D.C. and what that means for the autism community. I'm going to talk about some themes on the state level, and then Janet is going to talk with us about the tools that we have available for community outreach services and supports that are available right now for you in our autism community in Idaho. So without further ado, I'm going to turn this over to Dave, who's going to give you an update about what's going on in DC. Dave, over to you. Thank you.
Thanks, Judith, and great to be with you all today. As Judith mentioned, I'm going to provide an update on what has happened at the federal level in terms of congressional response to the COVID-19 pandemic, broadly in terms of the actions they've taken, as well as discuss some of the specific advocacy priorities we've been focused on related to the autism community, and then talk about what we anticipate happening going forward. Judith, if you can go to the next slide, please. Thank you. So we'll just start where things began in terms of the response to the pandemic. On March 6th, Congress passed the first bill related to COVID-19, and this was the Coronavirus Preparedness and Response Supplemental Appropriations Act. This was really the first attempt by Congress to start addressing some of the public health concerns, to ramp up funding for healthcare providers, and to try to just get a start on addressing the crisis. As we know, of course, it got much worse from that point, and Congress did take additional action, which I'll talk about in a second. I did want to point out that we have COVID-1, COVID-2, COVID-3 written here. The reason being is this is the way in Washington, D.C. that these bills have been described just in terms of their chronological order. And so if you see that in an article, et cetera, that's usually what they're referring to is just the order in which things passed. So the COVID-2 bill that passed on March 18th was in response to some of the individual and family concerns that had been coming up as the economic impact started to really weigh on the country, and also the scale of the number of people contracting COVID-19 ramped up. So the Families First Coronavirus Response Act established an emergency paid sick and family leave program for certain individuals and employers that have less than 500 employees, and we'd be happy to provide more information in terms of Department of Labor guidance and question and answers regarding that, because there's a lot of specifics in there. In addition to that, there were tax credits passed, free COVID-19 testing, of course, where available. There have been significant challenges in that. Expanding food assistance and unemployment benefits, and then there was an important increase in Medicaid funding, a 6.2% increase in the federal matching amount, which was extremely important during this difficult time. So in the midst of all this, there was a lot of discussion about a much bigger relief bill to try to mitigate the impacts across the country and assist families and individuals. So on March 27th, Congress passed the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Bill, also known as COVID-3. And this was a law that I'm sure you've all heard about. It provided $2 trillion in funding for a whole host of different areas. So for example, the $1,200 stimulus checks, or they're also called economic impact payments, $500 for dependents under age 17 that went out to most Americans. That was included in that law. The increase in unemployment benefits with the $600 additional amount weekly was included in that law. Hundreds of billions of dollars to public health and other healthcare providers. Similarly, money to state and local governments specifically for their COVID-19 response. The Paycheck Protection Program, which is a program to assist small businesses and other employers to retain employees in order to keep their businesses operating, was included in here. There's been a lot of press coverage around that. I'll talk about that again in a moment. There's billions of dollars included for school systems. So this included both higher ed and elementary and secondary education. And later on, Judith will talk a little bit more in terms of the breakdown of that funding and what Autism Speaks has been doing relative to our advocacy to ensure those dollars are hopefully directed in a way that will assist our community. And lastly, the law extended the Money Follows the Person program through November. Go to the next slide, please. And of course, there was a lot more to that bill. It was a large package. There were a significant number of provisions, and please don't hesitate if there are questions about anything that you heard about or you wanted to know more about. Just let us know. So even after that $2 trillion bill passed and became law in the end of March, there was still a recognition that there's likely going to be a need for another significant law passed to continue to provide relief to Americans. Those negotiations, frankly, are ongoing. They continue to this day, and when I say negotiations, I mean even just discussion of it. Sometimes, while you would hope there'd be more back and forth that's occurring, that's not necessarily the case, as it seems to be a bit stalled right now. But I did want to mention on April 24th, there was a bill called the Paycheck Protection Program and Healthcare Enhancement Act that did become law. And you'll notice that there's a COVID 3.5 reference. And the reason is that even amidst these larger conversations about a trillion or so dollar package, Congress decided to take action specifically related to the Paycheck Protection Program, that forgivable loan program for small businesses. At the end of March in the CARES law, they included $350 billion for that program. And because of the challenges small businesses have been facing, there was a huge amount of demand, and that money ran out very quickly. And so in order to replenish that program, and then through some additional negotiation, there was a very narrow bill passed to specifically address that issue, and also to provide some funding for hospitals, healthcare providers, and for testing. But it was very narrowly focused and didn't necessarily include the broader sweep of issues that people are concerned about. Can you go to the next slide, please? So both throughout March and into April, through May, and now we continue to listen and to try to respond in the way of advocating with federal members of Congress and federal agencies, I should say, to ensure that the concerns of the autism community are heard by policymakers, and to press forward as there's additional negotiation or additional bills that could be passed. So, while these issues that I've that we put on the slide here are some of the priorities. It's not necessarily all inclusive of everything that we've worked on over the time, and we're certainly always open to hearing more from all of you in terms of priorities or challenges that you think we should take a look at and work on. So the first one, additional funding for home and community-based services. So ensuring that the funding is there to provide for PPE, personal protective equipment, to ensure continuity in the workforce, to allow hazard pay and other pay increases to ensure that the workforce is available. In many other ways, this is extremely important at this time. And I know Judith will talk about HCBS as well. Additional funding to meet the educational needs of students with autism. We know that the distance learning format is not the same, of course, as the comprehensive programming that students receive when they're in person in school. And so, we have been looking at both trying to ensure that funding is there to provide whatever is available at this time, during this time where schools are closed, to students with autism, but also to ensure that schools have the resources they need to address the learning loss and to address the regression that we know has occurred during this time. And so we've been kind of advocating on both fronts. Protecting the rights of students under the Individuals with Disabilities Education Act, IDEA. During the month of March, there was a lot of discussion that there could be waivers passed by Congress to essentially waive IDEA requirements, at least during the pandemic, although we were concerned it could even go farther than that. And we disagreed with this notion. A number of other disability rights organizations also disagreed with that, and spoke out against any waivers of the core protections of IDEA. What ended up happening is in the March 27th law, Congress included a requirement that the Secretary of Education release a report to articulate any waivers that she thought were necessary to IDEA going forward. And fortunately, at the end of April, she released this report, and basically it did not recommend any additional waivers to the core protections of IDEA. So while a victory in a sense, we know that there is still a lot of work to be done to ensure that our students are getting the educational services they deserve. And while we'll stay vigilant in this area of any threats to IDEA protections, for now it seems like that threat has been mitigated. So expanding access to telehealth services for healthcare needs. For some, telehealth, the switch to telehealth has been really fantastic. There have been a lot of benefits for some individuals, and for others, it hasn't been so great. And it's certainly, again, not the same as visiting your healthcare provider or other therapeutic service provider in person. So what we've really been advocating for is to continue with the things that have been working for people on the autism spectrum, but then to also ensure that we're going back and being able to provide the right timely care that individuals need as we move forward. And so the other area that we're advocating on is kind of an expansion of telementoring to healthcare providers, so that we can so that more providers across the country have the skills and understanding of individuals on the autism spectrum to provide better levels of healthcare. So we actually are submitting a letter, I believe today, to the Centers for Medicare and Medicaid Services on this topic, and have been engaging with members of Congress on this as well. Eligibility for the $500 economic impact payments for dependents over age 17 is what I have listed next here. So The stimulus checks that went out to individuals across the country, were $1,200 per person and $500 for a dependent under age 17. We recognize the real inequity here. We've heard a lot from many individuals about how unfair this was, and we agree. And so we've been advocating as a part of a group of other organizations as well to try to reverse that policy and allow those payments to be made retroactively. There are a number of members of Congress that are very supportive of this. In the House of Representatives, I can't remember, there's between 150 and 200 members that have signed on as co-sponsors. There's a Senate bill as well. So we hope that that momentum can carry through going forward, and it's an area we'll continue to advocate on. Next is, according to caregivers of adults with disabilities, the same emergency paid sick and family medical leave policies accorded to caregivers of children. And I know that's a mouthful, but let me explain why we were advocating in that space. So as I mentioned, on March 18th, Congress passed a law and allowing for emergency paid sick and family medical leave to be available for a whole host of individuals, whether it was because of coronavirus-related impact, like specific illness-related impacts, I should say, or if it was related to the closure of school or a childcare center. However, what was less clear in the law was whether or not the same eligibility would apply to the caregivers of adults with disabilities whose normal source of care or programming was no longer available. We, along with many others, advocated with the Department of Labor that when they interpreted the law, they should allow that category of individuals to be eligible. Fortunately, they did decide to do that, and so we saw that as a positive step forward to kind of make that clarification. The next thing is preventing discrimination in treatment decisions and care allocations based on disability. As I'm sure you're all aware, during the really the surge of cases that occurred and some of the extreme challenges that hospitals and other healthcare providers were facing, I think there were a lot of stories about decisions that were having to be made about who gets care and who doesn't, and because of the lack of resources. And we applauded the Department of Health and Human Services, Office of Civil Rights, who issued guidance to medical providers across the country, telling them that there may not be discrimination in the allocation of care depending on someone's disability. And so, we again were pleased that that was that directive was carried out, and continue to advocate in that space. Some other areas related to this, we've been pushing for ensuring that personal protective equipment is available at group homes. We've heard a lot of very, very terrible stories in those circumstances, and then also ensuring that individuals with disabilities are able to have a caregiver with them during a hospital stay. And we've released statements on both of those topics. So we continue to stay engaged with members of Congress. I was telling our team here before that I know that some of our staff is going to be talking with at least one of the Idaho senators about the economic impact payment issue, in either today or in the next couple days. So we continue to stay engaged and advocating with members both in the House and Senate. Congressman Chris Smith from New Jersey and Congressman Mike Doyle, who are co-chairs of the Autism Caucus, have been working closely with us, for the past more than a decade, but in particular during this time to try to understand the needs of the community. They have sent letters to congressional leadership advocating for many of the priorities that we've articulated here. And I think the last letter they got about 40 members to sign on. Can you go to the next slide, please? So what's next? as I mentioned, there's negotiations, discussions, et cetera, that are occurring in terms of what may come next. On May 15th, the House passed the HEROES Act, which was the $3 trillion relief package that covered everything from state and local government assistance to housing policy to healthcare and more funding for the public health response. It was a very large bill. But I will say that it was really an opening salvo in the discussion about what comes next. The Senate has already said that they won't be taking up this bill. Senate Majority Leader McConnell has said that. And so this was just kind of a statement from House Democrats in terms of the policy that they would like to see be carried out in the next bill, but it's by no means the last and final version of the next relief package. That being said, there were some priorities that were included in the HEROES Act that we had been advocating for. So a substantial increase in funding for home and community-based services, $100 billion for education, dependents over 17 retroactively made eligible for the economic impact payments, clarifying the eligibility for emergency paid sick and family leave for caregivers of adults with disabilities, and $10 million for developmental disabilities activities. So while, again, those were important priorities and things that we're supportive of, in terms of the next steps, it's unclear. We continue to stay engaged with with the Senate and with the House as well to advocate on behalf of the priorities we've talked about today. But we continue to listen and hear from you, and would be happy to answer any questions.
Judith, no questions yet.
Thank you so much, Dave, for all that information. And now let's talk a little bit about what's going on the state level in Idaho. So as we've worked on state-focused advocacy during the time of pandemic, we've tried to focus on certain areas that really impact our communities. So healthcare, of course, is something that the autism community is constantly accessing. Home and community-based services, Dave mentioned those earlier. And then, of course, special education and early intervention are things that are very important to our community. So we want to talk a little bit about advocacy in that space. So when we think about healthcare, a big portion of healthcare is covered via public health insurance through Medicaid. And so for those of you who might use Medicaid for your health insurance coverage, a waiver was approved by the federal Medicaid agency, CMS, on March 26th. And what it did was really make it easier just to access your healthcare services through Medicaid during this time. And it provides some flexibility around prior authorization, pre-existing authorizations, pre-admission screenings and reviews. It had modifications for the types of providers that can be enrolled. And even it's allowing for provision of services in settings that aren't usually approved. So there is some flexibility there, just trying to help people access their health care when they're covered under Medicaid during the time of pandemic. And there is a link on this page, and you'll see throughout this presentation that there are links. And we are, just for your information, we're recording this webinar so you can watch it later if you need to, or you can also look at the slides. We're going to send those out with the live links so you can click through if you really want to get into the details of what these waivers read and what they look like. So we'll have the details for you. All right, so telehealth is something that I know in Idaho has been discussed, from 2015 on. When the pandemic really hit the country, on the federal level, Seema Verma, who is over CMS, that agency that oversees Medicare and Medicaid, she came out and did a press conference, and she talked about how all the Medicare and Medicaid plans would be rolling out telehealth for sure to fill in the gaps where they didn't have it before. So you're definitely going to see that with your Medicaid and Medicare services in Idaho. But you also have private health insurance. We know that Idaho, a few years ago, approved autism insurance coverage in your private health plans. But also during the time of pandemic, the governor came out to approve some modifications around telehealth for your private health insurance plans there in Idaho. And so the details of that can be found on this slide. He actually made this pronouncement on April 2nd, World Autism Awareness Day, which is just a coincidence, and suspended an additional 18 regulations to more quickly, efficiently, and safely respond to the coronavirus emergency in Idaho, adding to the 125 regulations he had already suspended in March. So hopefully your family is able to access autism-related services through telehealth during this time. As Dave said, it's not perfect. I think for some, it's been a lifesaver. For others, it's been the tiniest of Band-Aids on a really gaping wound. So we're trying to make it meaningful. We support the provision of telehealth, but we certainly don't want it to replace those critical in-person services and supports. Okay, so moving on to special education, where, you know, the adults, or not the adults, the children in our community access services. The guidelines for providing special education services were just updated for Idaho on June the 3rd. And they acknowledge that schools must provide a free and appropriate public education, but they also acknowledge that it's a balance. And they're pointing a great deal to the Office of Civil Rights and the Office of Special Education federally, saying that they recognize that these exceptional circumstances may affect how all educational and related services and supports are provided. And federally, that those departments are saying they're offering flexibility where possible. And we know for our community that leaves a lot of, you know, unknown questions and a lot of uncertainty, and that's really hard. So there's a link to the guidelines on this slide, and then there's also a link to information from the Iowa State Board of Education, just talking about the timelines and what things look like right now for kids in special education who are on the autism spectrum, who live in Idaho. You have received, to help out, some funding through the federal government. So Dave mentioned the CARES Act. There was COVID 1, 2, and 3. COVID 3 was also known as the CARES Act. And in that piece of legislation, there was money that was allocated to individual states, including Idaho. And so for your K through 12 education programs, including special education, $52.9 million was allocated. And that is being delivered through a formula to the different towns and school districts. So that should be coming and affecting your local school system. Post-secondary education, and I know there's some really wonderful universities in Idaho, received $78.9 million. And then the governor actually got $16 million to allocate for educational purposes according to the governor's discretion. And so that can actually be allocated to anything in that educational realm. And so we're asking that some things be considered as those gear resources, which is the governor's discretionary fund, is allocated. And so some of the things we've identified is just making sure that, you know, no matter where you live, if it's in Boise, if it's out, you know, somewhere in a rural area or a frontier area, that hardware, software, communication devices, and other assistive technology and access to Wi-Fi to broadband is available. So important, because you really can't participate in remote learning if you don't have the equipment or the access. We're very worried about children who are turning 3 during this time of pandemic and who are supposed to be aging into special education. It's a complicated time. It's an important time typically. So right now, while services are really interrupted, we want to make sure that those interrupted services are provided. And so if kids need to have a little extra time in early intervention before they move to special ed, we're asking that that be provided. We know it's been so hard during school closure for families who are home, who are under quarantine, to try to provide educational services, to fill in the gap, to do the Zoom learning, especially, for a big portion of the autism population who might really struggle with that. And then there are all those related services like speech, OT, PT. How are those being provided? So we want to balance safety with the provision of in-person services. We know that there are families who are very worried about sending their students back to school. They don't want them to be exposed to the virus or, be compromised in any way for their health. But we also are hearing loud and clear from families that they're desperate for in-person services, that the remote learning does not work, and that it's just generating so much anxiety and so much regression. So we're asking that those in-person services be provided just as soon as safe and feasible. And that could mean in the summer, like it doesn't have to be somewhere down the road in the fall, but immediately as soon as the appropriate staffing, equipment, protocols are in place, let's get those in-person services back up and running. And then, of course, for those who are aging out of special education and going into the adult world, there are so many things related to transition planning that are so important. And we don't want that entitlement just to evaporate because a student might age out during the time of pandemic. So we're trying to work with the states to remind them to provide those services anyway. They can certainly do that. States are doing that around the country, starting to do that in recognizing that those transition services have been missed. So that's just another area of state advocacy that could really affect some lost services during the time of the pandemic. We'd love to stay in touch with you. We have various ways to do that. You can certainly go on our website, autismspeaks.org/advocacy. And if you do that, please scroll down the page. There's a place where you can sign up for advocacy alerts. We will not spam you, I promise. But when things are going on the federal level, Dave mentioned, meeting with your senators right now. We want to hear from you and we want to be able to touch base with you. So sign up for those advocacy alerts, and also as things come up on the state level, we'd love to be able to engage with you. And you can also follow us on social media, on Facebook, on Twitter, on Instagram. So please, please do stay in touch. And at this point in time, I want to turn over to Janet Williams, who's going to talk with you about community outreach. But before I do, I don't know if we have any questions, Kelly.
We don't have any, Judith.
Okay, thank you. All right, Janet, over to you.
Thank you so much, Judith. Thank you everyone for joining us on today. Since COVID-19, since it hit our communities, well, first of all, I'm Janet Williams. I am the Director of Community Outreach. I'm actually sitting in for your outreach director. Her name is Marianne Sullivan. She was unable to be with us today, so I'm filling in on her behalf. But I just want to share with you, that since the COVID-19, it hit our communities, Autism Speaks, we have taken some very, very swift action to respond. We put a lot of other things on hold so that we could respond to the immediate needs of, those with autism and their families. In response, to all of this news and the rapid spread of COVID-19 among our communities, as you just heard Judith and David share, we urge lawmakers at the local, state, and federal levels to take immediate action to protect our communities, which is so very important. I want to encourage each of you, if you go to autismspeaks.org on our homepage, you're going to see a yellow banner that drops down, and that banner, it has a lot of, you click on it and there you will take you to a page where we have all of these COVID-19 resources that are available to you. Of course, we also have our, our resource guide and all of our other information. But we know that all of this is challenging right now. We know it can especially be challenging and hard for autistic people and their families. And so, with everything that's happening around the globe, it has forced us to adapt in ways in which we've never have before. We're confronted with some of these radical shifts and changes in our schedules, having to utilize different modes of communication, changes in social demands, and of course, those increased safety risks, which are causing us to wear masks and to social distance from one another. So, of course, this pandemic, it has imposed adversity in the form of challenges with health, our economic stability, and of course, our overall and general well-being. As concerns and the fear for the unknown rise about COVID-19, we will continue to fulfill our mission and, supporting our constituents, listening to the needs of our communities, offering support where it's needed, and creates free, tools as we always have, and offer a sense of community at a time when it's needed more than ever. Next slide, Judith. As Judith stated earlier, about our autism response team, we have an amazing autism response team, and they provide information in English and in Spanish for the needs of our community. Just to share a little bit of background about our autism response team, they are a group of highly trained employees of Autism Speaks, here to support you and help you navigate our website and just navigate resources that may even be in your backyard. In 2019, our autism response team, they helped tens of thousands of people through those one-on-one conversations with specialists that are trained to provide information about autism-related programs and services throughout the lifespan. Our Autism Resource Guide, it contains a database of thousands of local services, resources. Again, some of them are right in your local area. And we also have some free downloadable toolkits, like our most popular 100-day toolkit, which is a guide for the first 100 days following a diagnosis. We also have this toolkit for adults who are newly diagnosed. We're actually seeing an increase in calls coming to the autism response team from our adult community, asking where can they go to get a diagnosis, because during this time of being, in and dealing with the pandemic, a lot of them are realizing that, hey, I may need some additional support, or at least let me go and find out what's going on with me. It's important that we take care of ourselves as much as possible and take care of those that are around us as well. And so all of our toolkits and these resources, they're free of charge. You can reach out to the Autism Response Team. You see their contact information on the screen. And so, and also, there's the point of having some financial support. Our Autism Response Team, they're available and can help connect you with any grant opportunities that may be available and any other resource information. Our Autism Response Team, they've seen an increase of calls in a lot of different areas, but again, specifically for adults, those that are losing their jobs and increased need for mental health resources. So parents and caregivers are looking for help amidst this disrupted routines, and there's also, as they stated, an increase in challenging behaviors. So we're here, to help you and provide you with the resources that you need. Feel free to reach out to us. They're available. You can speak to someone Monday through Friday between the hours of 9 and 5. You can chat with them at any time. You can also email them 24 hours a day as well. So please reach out to them at help@autismspeaks.org. Next slide, Judith. And so, just want to talk about, we know that school is now closed, but we don't know what that's going to look like, come this fall. We don't know how, what schools will be reopening, how they will be reopening, what it's going to look like. But we also have a lot of resources dealing with some of those school closures. And we know that it was challenging, when schools first closed down. But some of those resources that we have available still apply today, because it would help you to help your child and prepare them for whatever the school system is going to look like when they do reconvene. We have resources on how to handle clinical care doing social distancing and those school program closures, and what the autism community, what they know about the coronavirus, what should they know about the coronavirus outbreak. So all of those resources are there. We have information from the National Association of Community Health Centers and also from the CDC. These resources are available on our website 24 hours a day, 7 days a week. Amazing resources. We also have now some information about our summer camps and summer activities. I will tell you that all of the camps that are listed on our website, all of them are not autistic, camps for autistic individuals. However, most of them are. And so feel free to reach out to the Autism Response Team again for support on identifying camps that may be in your area for your loved one. And it will be up to you, of course, to reach out to them, talk to them about their programs, and find out if it's a best fit for your loved one. Next slide. And so again, our resource guide is available. We have so many resources, on our website that you can reach out to. You can search by topic. We also have some amazing new transition toolkits and platforms that are available for you to navigate to see what that's, what it's like. And also some community-based skills assessments that you can use currently, to help gauge where your loved one or your child is at this time as they navigate, through a transition process, or even, just navigating from one, maybe elementary school to middle school, or middle school to high school. Just all of these resources are available and helpful. So again, reach out to us if you need any support. We have information on health and wellness, behavior challenges, community life, of course, family support, and a lot of resources for our adults as well. And so we're constantly adding to that resource guide. So if you don't see what you're looking for, reach out to the Autism Response Team so that they can help you find the information that would be specific to your specific needs and your specific family. So again, I just want to say, thank you so much. Next slide, Judith. Thank you so much, for joining us, and I'll turn it back over to Judith at this time.
All right, thank you so much, Idaho Autism community, for joining us today. We hope that this was helpful information, and we hope that you will stay in touch with us moving forward during this time of such change in our community. As I said, we're working for you and with you on the federal level, on the state level. And so thank you so much for taking time to hear about that today. We will talk again very soon. Take good care. Bye-bye.